Hello, everybody. Welcome to our Start or Sit podcast. I'm Shannon O'Kelley, physical therapist, and he's Dr. Hawkins, sports medicine, orthopedic surgeon extraordinaire. What we do here, as mentioned earlier, we're talking about last week, which was week number 6. So we're talking about last week's injuries in your NFL and possibly your fantasy football player, and whether or not this week, week number 7, is that player going to start or going to sit. Dr. Hawkins, how you doing?
I'm doing great, Shannon. It's the clouds have broken. There's a little sun. I just got out of the hospital, so it's a good day.
It's a good day. It's a good day. You weren't in the hospital. You were in the hospital doing surgery, not in the hospital. For our listeners, so I just want to
exactly.
Sure.
Exactly. Yeah, today was a busy surgery day, taking care of a lot of people, a lot of ACLs, a lot of rotator cuff, a lot of labral tears.
That's why we love having you on this program, our Start or Sit podcast. You're a sports medicine specialist. You just said it. Labral tears, shoulders, ACLs, very common sports injuries. Are you ready to get started, Dr. Hawkins?
Absolutely. Let's do it.
Let's do it. Okay, here we go. Josh Reynolds, Denver Broncos, wide receiver. He's got a fractured finger, and I heard he is going on the IR. And Denver is not looking too bad, but they have the Saints coming up this weekend. So, actually, it's this Thursday. What do you think about Josh Reynolds? Fractured finger, sounds like IR. Tell us about that.
Yeah, so he actually initially they were thinking about just having him play with a splint, and what they decided to do is put a pin in. So sometimes with these sort of minor finger injuries, they can put a pin in using like a small x-ray machine, line the bones up, put a smooth pin in, and then that pin will stay there temporarily for about 3 or 4 weeks, and then they'll take it out, and that'll just sort of maintain the alignment better than just keeping it in a splint. So they sort of made, originally when it first happened, they thought he just might miss a week because, again, I think they were hopeful he could just splint it and play with it. So now that they put that pin in, they will, the pin sticks out through the skin a lot of times, so they probably won't, want to put him on IR. No risk of infection or breaking the pin or anything like that. So he will be out this week. But the good news is it does not sound like it's a major injury, and they're just doing this as a precaution for him.
Yeah, it sounds like they're talking about possibly being back sometime in mid to latter part of November. I think I read something like that. So this pin that they're putting in, just real quick, out of curiosity. So they talked about, hey, can we splint this player? A splint would be a soft splint to keep everything in alignment while that fracture heals. Now, as a surgeon, I mean, in the hand area particularly, why would they say, no, let's put a pin in there? Is that to promote healing, to have better alignment, to have better outcomes? What's the decision there?
Yeah, I think in this case, it's probably that where they weren't really convinced that they could maintain alignment with just the splint. And so, oftentimes they can put the splint in, they can then actively rehab the joint on either side of that. So if they immobilize, the bone at one level, then they can work on some range of motion, avoid the atrophy things, stuff like that, while assuring that that bone won't shift while it essentially gets sticky. The early part of that fracture healing is important. But the fact that it's only a 4-week process, we know that a bone is not fully healed at 4 weeks. So the fact that's why we know it's a minor injury. It's one that was probably borderline, and they just probably erred on the side of this is probably going to be better for him long term, and actually perhaps a quicker recovery to full 100% by doing this.
That's good stuff, Dr. Hawkins. Josh Reynolds is out. Keep an eye on him. Probably the mid to the latter part of November, I believe. Like I mentioned earlier, he's going on the IR. That's a 4-week out automatically. Next up is San Francisco. They look good. They whooped our Seahawks the other night. Just whooped us. I'm sorry about that, Seattle. I still love you guys. Jordan Mason, San Francisco 49ers running back. This is the first for us this season, is an AC joint separation. Wow, one super painful, takes time to heal. They've got, again, let's see, they've got the Chiefs coming up this Sunday, 49ers versus Chiefs. Big game. What do you think about Jordan Mason with an AC joint separation?
Well, you brought it up perfectly there, Shannon. It's a very painful injury. For our listeners, that AC joint is sort of the bony attachment between the end of your collarbone and your shoulder blade. So it's the one attachment from a skeleton standpoint, a bone standpoint, for your whole upper extremity to the rest of the body. So a lot of stress goes through that area. And again, they can kind of grade out these injuries. They can be sort of mild, which are grade 1 sprains where the ligaments and stuff are stretched but not torn. But those are actually oftentimes the most painful ones because they still touch. When you get greater degrees of injury, those ligaments can tear and the bones actually shift. Those people will have like a large bump on the top of their shoulder. And believe it or not, those don't hurt as much, but they can cause some deformity and it can cause some disability over time. So sometimes those are treated surgically. So he landed hard. He actually went back in the game. So that usually tells you it was a grade 1 injury and it was painful. So they just took him back out so that he didn't progress it into a higher level injury. And the prognostication in this really comes down to he has not practiced contact yet this week.
That's right.
And so that's not a good sign. And they've done really well with their backups. You know, when he came in, he was a backup and he did great. But they've now had Isaac Guerrero come in as a rookie, and he's done well. And they've got another guy there that's an undrafted free agent that was playing too. So I think I'd lean on not playing him. He may try to get in the game, but if you have him as a fantasy person, I don't think his production's going to be good. He likes to run like, you brought up the Seahawks, he likes to run like Marshawn. He likes to run hard and hit people. And so that's not going to work so well with this injury.
Yeah, listen, I've had an AC joint separation, and I tell you from experience, personally speaking, they are painful. I mean, it just raising your arm, even walking by someone, even if you lightly brush up against them, it is a hard joint to protect. It's a hard joint to stabilize. I mean, there's no specific padding out there. I can't imagine a running back with being 1 week AC joint separation, grade 1, coming back into contact. So most likely he's a sit if he's on your fantasy football team, and might be a sit for 1 or possibly 2 weeks with that type of injury. Fair to say?
Yes, absolutely.
Oh man, great explanation. AC joints, they're so painful. This, for our listeners, this is the typical quarterback injury that you see the quarterback rolling out. The defensive lineman comes in, grabs the quarterback, wraps him up. He goes down to the ground, lands on his shoulder. That lateral impact into that shoulder sprains that AC joint. We see a lot. I think we've had several quarterbacks over the last couple of years that have had the AC joint separation. Here's a guy, I don't really know particularly what's going on here, but he's on our list. I want to talk to him because big move here, big move. Davante Adams, I think he was recently traded from the Raiders, and he just recently was traded to the New York Jets. And I don't know what his status is because when he left the Raiders, he had, quote, they're calling it hamstring strain, but we didn't really hear, basically hamstring pull, tear, whatever you want to call it. We didn't really hear what's going on there. You have any thoughts on Davante Adams?
Yeah, I think what you have is he's the classic example. He did probably have a mild strain injury. I think it was around week 3, and he wanted to get traded as well. And so some of these like higher profile players will basically kind of nurse that injury, basically to kind of sit out, put a little pressure, not hurt themselves more, and try to expedite, trade talks. So I think this is a situation where he's probably has been recovering, has been getting treatment, and now that he's got this trade, as long as he passed the physical, which I believe he did when he was traded, he's probably going to be a go this week. Now, how well he can run plays and do everything, he obviously is known Aaron Rodgers and played with him before. So I think he might have a limited repertoire of things, but I think they trust each other. So I think he's actually a good play this week. I think that injury was nursed along, and probably, he could have been back ahead of this trade if he hadn't been trying to force things.
Well, yeah, good call. The Jets play the Steelers this weekend. I will tell you, I happen to watch the Jets Monday Night Football. Man, they're close. They do not look bad. I think they missed 2 field goals, and I think they had a touchdown call back for a holding penalty. And we talked about You mentioned it earlier. Are the Jets the one that they have the rookie wide receiver that was leading the league in receptions, and he's out right now with a concussion? Malik, is that the Jets?
That's the Giants.
The
Giants. Malik
okay.
Neighbors.
Yeah. Okay. See, I knew it was New York. I knew it was somewhere in New York. I was listening. You're pretty impressed.
The Jets. Yeah.
Go ahead.
Yeah, the Jets are trying to kind of figure it out because they had that still a young wide receiver. They have Garrett Wilson.
That's
there,
right.
And,
That's right.
He has not been making like that connection with Aaron Rodgers everybody was hoping for. So people are hopeful now that now that he has Davante Adams and he can spread the ball around to people he knows a little bit more. He's been throwing it to Allen Lazard like crazy. And Allen Lazard, was his ex-teammate. So.
Yeah, I mean, did you watch Monday Night Football? I mean, that long bomb, another Hail Mary by Aaron Rodgers. I mean, 40-yard, 50-yard pass in the air, and Lazard came down with it to score right before the halftime. Pretty impressive.
Yeah, that was pretty amazing.
Yeah, it is. Okay, here we go. New Orleans Saints. This is another injury that we haven't talked much about this season, but Alvin Kamara, I mean, super important to the New Orleans Saints. Running back, he's on fire, really productive guy. He's got a hand injury. I don't really know. I tried to dig around. I wasn't able to really find out what's going on in his hand. Do you have any updates? What do you think?
Yeah, it's the quote unquote word on the street with this. You're right. They haven't been really definitive, but it sounds like this is basically a mild sprain of one of the collateral ligaments in his hand.
Oh, okay.
So the collateral ligaments they're the collateral ligaments are the ligaments on the side of the joint that kind of keep it from bending, to one side or the other. So we've always talked about like the MCL in the knee. So similar thing that we have around all the joints. I'm not clear if it's at what's called his MCP, his metacarpophalangeal joint, or if it's a PIP injury. But he's actually had this designation in his injury list even before this weekend. But I think it got aggravated a little bit in this past week. So he's been held out of the contact stuff in practice. But I think he'll be a go. He's a big, important thing for what they need to do.
Yeah, he's a go. I would agree. Alvin Kamara, not a lot of information on it. No one's talked about any kind of splinting or diagnostic tools or interventions. He's a go. He's a go this week against the Broncos. Broncos are playing the Saints. Okay, here's a guy that we both know well, and he has not played the whole season, and here we are going into week 7. Russell Wilson, quarterback, Pittsburgh Steelers. Understand there's a little activity with him in practice now. He's going back to some kind of calf injury. Should possibly a significant injury. Going back to training camp. He has not played, have not started. They're talking about it. What do you think? Justin Fields, I think, is looking pretty good. Any thoughts there?
Yeah. This one hits hard for me because I've actually been using Fields on my fantasy team, and he has been doing well.
I see how it works. Yeah, I got you now. Yeah. What do you think then?
Yeah. Well, the take home is it sounds like whether it's from the coaches or the management that they really want to give Russell the opportunity to see if he can deliver on his contract. They paid him a lot of money to come there. So he took first team reps today in practice, which is a very strong sign that they're going to start him. I think the biggest concern I would have if anybody's thinking about putting him in there for fantasy is the last time we saw, Russell, or the last year that we saw Russell, he was very hit or miss. And I have a feeling that, time is catching up with him a little bit. But that if you have that opportunity, if you're like me and you have Justin Fields, it looks like he's getting demoted, even though the Steelers are 4-2 on the season and they are going to start Russell. But I think I'd be a little hesitant. He's an older guy. He's coming off a soft tissue injury. So those are the things that get aggravated. If he has to get chased around by a defensive end, you could see him having to sit out quickly.
Yeah, so you're saying he's probably going to start, but he might not finish the game. Potentially, there's a chance he may not finish the game. One, depending on how he does performance-wise, and two, how the injury or the calf injury holds up in that game. And I think that's what I'm hearing you say. Is that correct?
Yeah.
Yeah.
Yeah, exactly. Yeah.
Kind of interesting here. I mean, we look at sports, and sports is a huge, huge business. I mean, and here you got, Justin Fields, who they've got him kind of a winning streak going, or he's doing well with Pittsburgh, I should say. And then they've got this high-priced, big-name quarterback that I wonder how Mike Tomlin really feels about this. It'd be interesting to find out if he's getting that management pressure because the dollars and cents that have been spent on that contract, as you kind of indicated. That's sports, right? That's sports in the big arenas.
Yeah, 100%.
Yeah, no doubt. We'll keep an eye on it. That's good stuff. And I like Russell Wilson. I think Russell Wilson's great. He's fantastic. He was fantastic for Seattle, and I only wish Russell Wilson the best. But I also like Justin Fields, too. He's looking pretty good. Hey, here's a guy that I don't think he's played. I think he was injured, if I remember right, last year, week number 2, going back to 2023 here. Nick Chubb. Man, this guy, I think he sustained everything in his knee. ACL, PCL, MCL. He probably had surgery. He is currently on what they call the PUP list, but there's talk of Nick Chubb coming back. Now, He's been out a little over a year with that amount of injury. You think he's ready? You think he will come back? I mean, obviously he's an elite athlete. What's your take here?
Well, he's if people remember going back a while, he had bad knee injuries in college too.
Yes, that's right.
So this is sort of like a second go around for him. So the good news is he came back very strong from that. He basically was at an all-star level. And this is an appropriate amount of time to have allowed everything to heal, to do all those things that, as a physical therapist are super important, the balance, the proprioception, all of those things. And I think it's worked out nicely for him from the perspective of his, the person starting ahead of him is a bit nicked up going into this week. So the timing allows him to come off that PUP list, and it looks like he is going to get a start this week. Now, again, a second big knee injury, maybe he's not going to, catch lightning in a bottle a second time. But I think he's going to be somebody that is going to start, and he's going to be their primary running back, I think, coming out of the gate. Even when you're on the PUP list, you're able to practice. So he's been practicing for a few weeks now, just not allowed. I think it's essentially after the 6-week mark is when you can come off the PUP list. So I'm cheering for him. I mean, he's
me
some
too.
bad knee injuries.
Me too. I think he's so you think he's going to Cleveland Browns? Let's see the Browns take on the Bengals. That's a big game. That's a big game. So you think he's going to go? Nick Chubb's going to go. So if you have Nick Chubb on your team, or want to draft him or whatever you need to do, he's likely going to play, and he's a fantastic running back when he's healthy. Like Dr. Hawkins just said. I mean, he's got a little over a year to heal major injuries, a knee injury previously, but he's an elite athlete. I'm hoping for the best for Nick Chubb, running back, Cleveland Browns. All right, Jonathan Taylor, this guy, he was hurt last year, I believe. Another running back, Indianapolis Colts. They're looking pretty good. They do have the Dolphins. The Dolphins are struggling. They play the Dolphins. He's got this, what we've talked about before, this high ankle sprain, a little bit more from a mechanism of injury, a little bit more tissue disruption, a little bit more difficult to come back from, et cetera, et cetera. He has not been able to sustain a practice this week. And because they're playing the Dolphins, do you think they're going to rest him, or do you think they're going to play Jonathan Taylor, running back, Indianapolis Colts?
Yeah, I think he's a really hard one to call because he's kind of had this nagging injury. They've said it's not as severe as the one that he had last year, but I think it's in his head a little bit. This is not obviously the orthopedic side of it, but this is sort of the shrink side of it here. I think he probably pays a lot more attention to the tightness that comes along with these injuries and the feedback he's getting from his body, and so I think he's hesitant to push himself hard if he doesn't feel great. So I know a lot of people would like to start playing him, but I think until you see him have a full week of practice, I don't think he's a good person to put in your fantasy lineup. I think once he has a full week of practice, then I think that's going to be a good sign. And we always talk about what we get right and wrong. When we first talked about this guy a couple weeks ago, I thought he was just going to, miss a game and come back. So I want to own up on that one. He has stretched this one out. And I think, like I said, I think it's more of a mental thing for him now than physical. That's my interpretation.
Well, yeah, I mean, I can't remember if this is the same ankle that was injured last year, but I mean, yeah, mentally it's hard to come back. I mean, matter of fact, the other night, the quarterback for the Giants, he came back from ACL surgery, I believe, last year, and Chris Collinsworth, as he was doing the broadcast, just kept talking about how hard it is to come off of rehab, particularly an ACL, and this kid, Daniels or whatever his name is, I'm blanking on his name, the quarterback for the New York Giants, he was running into the line and just really being aggressive, putting his shoulder down and hitting. And Collinsworth kept saying, that's amazing. If you all don't know what it's like to come back from rehab, particularly an ACL, what he's doing out there is very courageous. It's hard. It's hard to come back from an injury. Sometimes, I mean, as in the physical therapy world, a lot of times a good physical therapist is a good coach and a good listener and just like a good doctor. Sometimes you just have to coach people through this kind of stuff. It's difficult. Hey, Dr. Hawkins, here you go. I got a trivia question for you. Let's see. In 2024, the early season of the 2024-2025 NFL season, who is leading the league in sacks?
Ooh, is that Aiden Hutchinson?
Good call. Nice. And I bring that up because, boy, I tell you what, you're the bone doc here. I mean, I watched it tonight. He went down and put a splint on. Whenever you see an air cast come out of the trainer's bag, pretty much assume if they're putting an air cast on a lower extremity, you pretty much assume, at least I do, fracture, right? I mean, that's fair to say? I think
yeah.
Okay. And in a little while later, they were talking about tib, not just tibia, but tib fib fracture. Orthopedic surgeon, what are you doing here? What's going on?
Yeah, I mean, obviously a super unfortunate injury. You know, we've seen some people have these over time. You know, Alex Smith was one of the famous guys that had this type of an injury. There actually were a couple basketball players that had similar injuries where they were just jumping and coming down. I saw that. Collegiate guys. Yeah, and then if we go back and date ourselves, we can talk the Joe Theismann days when when he got his leg snapped. Yeah, God. But the weird thing about Aiden's thing is it didn't seem to be a very high energy injury. Meaning it didn't seem like somebody fell on him. So I think one of the concerns, and nothing's truly come out yet, but when this injury happened to one of the basketball players a few years ago, what it turned out is that he actually had a bone cyst. So a lot of people will have cysts in the bone sometimes. And they're benign, but they can create a stress area that's a little bit weaker. And so the good news is regardless of how it happened, as long as this isn't an open fracture, it's something that can be fixed well, relatively minimally invasively by putting a rod down the center of the tibia bone, and the soft tissue around it does not have to be disrupted very much. So that allows weight bearing early on. It allows you to start working on your knee and your ankle range of motion. And then the fracture can heal, and the fibula as a non-weight bearing bone usually will heal on its own. So it's a devastating injury for a guy was having such a great year and is a leader for his team, and everybody loves him. But the good news is with what he does, how he plays, he should be able to recover from this. And God willing, he doesn't get, a perioperative complication like Alex Smith did with an infection. That's where things go south, you know, but otherwise this should heal well and he should come back, and it'll be next season. But, the good news is that Detroit should have him for a lot of years in the future. So just give me kind of rough parameters here. We're talking right now, next season. I mean, is this with the hardware put in place, the rod inside the tibia, probably going to put a plate on the fibula. They'll put some kind of hardware there. Fibula, as you said, is non-weight bearing. The healing process. Is he back for training camp next year or early season? I know I'm not trying to put you on the spot. Give me a window. Yeah, no, I think 6 months he'll be released to get back and do stuff. So I think he'll be ready for training camp and stuff like that. And in the fracture, most likely, it's probably what I think you would call, and I'm just assuming because they took him in for surgery and you're talking about metal. So the fracture probably was mid shin. So this is not something that fractured down into his talus or the mortise joint down where the tibia and fib come together. This is a shaft fracture. That's why you're doing a rod, I would imagine. Exactly. That's, it gives you the weight bearing, it keeps the weight bearing
Yes.
axis in the middle of the bone. So, you don't have to protect it as much with weight bearing and stuff like that. If you remember a couple years ago, Dak Prescott had that
Yes.
sort of bad ankle injury.
Yes. Yes.
His was distal, so down just above the ankle. And so, he's done extremely well. And that was probably a more risky injury to recover from.
Yeah. I feel bad for Aiden Hutchins. I mean, he's a real meal deal. And I like the Lions. The Lions are on fire, and they were my team this year. And I was sad to see that. I'm sad to see anybody get injured. It is a game of contact. It is a game of injury. And these, the medicine out there and the technology and the advancements in medicine. I'm sure just how many years you've been doing this, and when you started, and some of the advancements that you're seeing, and some of the minimally invasive surgery, and some of the techniques you all are learning and doing. I mean, the recovery's come a long way. This is quick. This is not a cast. I mean, this fracture, he's not going in. He's going to go in a boot or something like that. He won't be in a plaster cast for 6 months or something like that, right?
Exactly. Like those days where you'd see somebody laying in a bed and in traction, with a pin through their leg, holding things straight for, 4 weeks while they would let the fracture stick together a little bit.
Oh, man,
none of that nowadays.
Yeah, none of that. We're very aggressive. Get that patient out of bed, get them walking. Matter of fact, a lot of these surgeries are now done in outpatient surgeries, ambulatory surgery centers, which is good for the patient. We've come a long way in our rehab and technology. I remember as a kid, you kind of, this is kind of silly, but when someone fractured their arm or something in your class and they got to wear, you got to sign their cast. And that was, and that was kind of a rite of passage, is get your cast signed, right? You never had a fracture, have you?
Yeah, you know what they do now? They get their boots bedazzled. That's what they do now.
We'll have to talk about that when we get together for our next show. I want to dive a little deeper in that. Dr. Hawkins, you're awesome. Great job. I love working with you. I love talking with you. And we'll catch you next week, okay?
Sounds great, Shannon.